I have a lot I want to share with you today. You know, we try to be lighthearted because we want to stay connected. I also have some serious things to talk about today. So let's go ahead and start with the data. First of all, at this point, we are at 3,739 cases as of this morning. And I'm sorry to share that we have 102 deaths here in Ohio. I'd like to go to the next page and just show you again our dashboard. It has those age ranges, again, about equal male-female, and showing that we have, in fact, tested 41,000 tests have been run in Ohio at this point. Next slide, please. So this is new today. This is responding to our media. I have so much more to share, more numbers with the media. The governor shared something about our hospital increase in capacity. I want you to know that there is a ton of action. We're sitting here in a very quiet state house sharing this with you. Behind us is just an incredible array of activity taking place. And next week, I'm committed to sharing more of the numbers with you because we've had teams working nonstop to put that together for you, but also more of the stories from the front lines, because I know it's very hard for us to talk about things and you not see them, but behind us, there's so much happening. So this is the beginning of some of our death data breakdown, and it's very hard. Again, we still don't have a lot of numbers. I've told you that deaths really lag behind becoming infected and being hospitalized, and deaths are sort of a very later in time way to measure the impact of this virus on Ohio. But what we do know now, I do want to share with you, again, we know that the elderly are the most vulnerable. Of those hospitalized, it's really going across all ages. We certainly see deaths being much more likely in people, again, who are at risk and elderly. But I do want to point out we are seeing some of the deaths in younger people and people who did not have pre-existing conditions. We will have more and more understanding of this. You can't take these numbers yet and say this is what it will be the story for Ohio all along. There's just too few to make that kind of judgment yet. But it is data that we're following along with a wide variety of other measures, and we'll be sharing more with you in the week to come. Next, our curve. We will also be talking a lot more about the fact that you are being successful, Ohio. And one of the things that is keeping me up at night is when I say we're being successful and we're not seeing yet, that's why I want to bring you more of the stories from the front line. When we're not seeing, maybe telling our story here, standing here, of what our hospital providers are facing, I want you to know that we are flattening that curve, but we can't let up. The only weapon we've had is slowing this down, and Ohio has done an amazing job. And we are seeing that this is continuing to flatten, which is giving our hospitals a little more time each day. But I want to talk about masks in a little bit, and I want you to know that masks are going to be in addition to what we're doing. They are not to be done instead of what we're doing. It's very, very important because it can give us a false sense of security, but it's so important that we use this as another tool, not in substitute. Next slide. So this is fascinating. This is the beginning of some of our data on how our social distancing is working. We have proxies. There's no exact way to measure what we are doing, Governor, to stay at home. But our models are very based on our behaviors. And this is where you and I, are changing this hurricane from a Category 5 to Category 3. So here are some of the things we can look at. This is Google data that shows a little bit about our mobility changes, but we also have data from traffic. Like we can actually look at traffic patterns in Ohio, and there's cell phone data that is looked at. Now remember, this isn't your individual personal data. I know this is a touchy subject for a lot of us, but it is like aggregate data and usage. And it is so fascinating because we can see in Ohio the decrease we're making on retail by being out. We're actually doing more retail delivered, which is exactly what we want to see. We can also see a decrease in general transit. But what we see is an increase. Look at this increase in our parks. So we're using those more. And we can see an increase in activity at home. These are all measures, they're proxy measures for how well we are doing this, staying at home and taking this seriously in Ohio. There's a fascinating map out there that was in the New York Times that shows the whole country by things like transit and by cell phone usage, and you can really see the collective Midwest impact, which is priceless to show that what we're doing together is making a difference.